Welcome to Native Bidaské, Native News Online's weekly spotlight on the people making news and leading change in Indian country. Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
Welcome to another edition of Native Bidaské. I'm Levi Rickert, publisher and editor of Native News Online. And joining me today is Jenna Kunze, our senior staff reporter. Jenna, how are you today?
I'm good. How are you, Levi?
Doing well. I'm doing well. We have a very special guest. Joining us is Chairman Tony Hillaire from the Lummi Nation out in Washington State. And now, earlier this week, Monday and Tuesday, the tribe held a Washington State Tribal Opioid Fentanyl Summit, strengthening pathways to healing. Now, this is the first summit ever. And I want to welcome Chairman Hillaire. Tony, how are you, sir?
I'm good. How are you?
I'm doing well, and welcome. Now, earlier this week, as I mentioned, you hosted that first ever summit to deal with the problem of opioid on your reservation. Why was the summit held in the first place?
Yeah, thank you, and thank you to Native News Online for the coverage and for helping us in our effort to raise awareness. And I think that's exactly it. We all know in Indian country that some of these impacts to our communities have long-lasting and severe hurts and pains to our people, and so we wanted to make it a more of a serious issue. And when we go across Indian country to some of the conferences in healthcare or even leadership conferences, we noticed that this particular issue, this elephant in the room of fentanyl, was not being talked about. And so we've been working really hard to try and raise the level of seriousness of this drug and the impacts that it has on our communities.
Chairman, can you tell us a little bit about how opioids and substances such as opioids are getting in the hands of tribal citizens?
Thank you. Really great question, and it brings up a lot. And that's one thing I wanted to note is the issue is very complex, at least here at Lummi Nation, of how to address the fentanyl crisis and drug epidemic that we're experiencing. But really, drugs are coming in by drug cartels and those who are making these drugs, dealers on our reservation, and that brings up some complexities that need to be addressed when it comes to jurisdiction and working with the state and surrounding cities and counties, and have alignment in our laws when it comes to federal law, Lummi law, state law, local law as well. And how do we enforce it? How do we keep our streets safe and get as much drugs off the streets as possible?
Mm-hmm. Levi and I have spoken with President Fawn Sharp before, and she has expressed similar concerns about the complexities also with being a tribe that is has all different ports of entry. So you're on the water. You also mentioned that you're close to the border of Canada. So I'm assuming that also adds to complexity in that there are so many access points. Is that the case? Yeah,
exactly. And our I-5 corridor, Interstate 5, the freeway here is right up against our reservation as well.
Interesting. Yeah. I could see how.
Tell us about that cross-jurisdiction the legalities in terms of how law enforcement works together. Now, is the FBI get involved, DEA get involved, state? Tell us about that.
Yes and no, and that's the struggle.
That's the complexity. Huh?
Yeah, exactly. So we have a reservation here, and on our reservation is a county road that is utilized by us as tribal members that live on reservation and off reservation, as well as the county residents here. It leads to a ferry that goes to Lummi Island across the water from us. And so say a drug dealer comes on reservation and is on the road, and we pull them over on a county road, whose jurisdiction is it? Is it federal law, being a sovereign nation, a federally recognized tribe, or is it a county sheriff issue, being that they were pulled over on a county road and they are not Lummi tribal members? So who has jurisdiction? And so that's the trouble. And yes, we work with the FBI and DEA. That is something that we're really pushing for, is to have a more closer to home office for the FBI and DEA to do more drug interventions, drug interdictions on reservation, to help us get as much drugs off the streets as possible. We learned that when we arrest a drug dealer, usually they will hand that business on to either their child or a nephew or a niece or a relative, and then we're back into the same issue. And then also that we shut down a drug home, that another one will open down the road. And so one of the things that we've learned is that we need to get as much drugs off the street as possible. And so we work with the FBI and DEA, but it needs, given the severity of the issue and how many lives we're losing to fentanyl, it needs to be more often. It can't just be a once a year or a 2-month planning for a drug interdiction. It needs to be something that's reoccurring. And that's just one part of the complexity to get drugs off the street. We also need to talk about mental health and housing and treatment and detoxing and workforce development and recovery. And, there's just so much to it. And we're doing our best, to work through all of these legalities. But that's why things like the state tribal summit is important. That's why the national summit happening, in the federal national summit is happening at Tulalip, August 22nd to the 24th. That's why it's so important. These issues, these questions that you're asking, we need not just answers as to what the gaps and the issues are, but real solutions of how we're going to address it, how we're going to work together, how we're going to work in partnership, how are we going to acknowledge sovereignty and treaty rights, how are we going to take care of each other.
Yeah, that is such a big problem, and we do know that it's not just limited to Native Americans. I mean, when the CDC released the life expectancy, which was lowered after the pandemic, I took interest in the fact that I thought most of it would be attributable to COVID-19, but right there was opioid fentanyl deaths that have risen so greatly that has cut into the life expectancy of the average American. And I think our numbers we see, what is it, Jenna, anywhere between 35 and 40% higher among Native Americans, some of these tragic numbers. And so it's a very big problem. Jenna, go ahead.
We lose more people to fentanyl overdose than we did COVID-19.
Wow.
And the thing about it is that we can't compare the two together in a way of like, if we could just get vaccines and wear a mask and social distance and shelter in place to get rid of fentanyl addiction and substance abuse here, we would do it in a heartbeat. But it's not the same. It's not the same of how we're going to address it. But what is similar is that we all of us collectively came together and made COVID-19, this global pandemic, a priority, and we all put our people's health and well-being at the very forefront. And yes, we're trying to do that today. We actually do that. It's just it comes down to building our capacity to really make a difference.
You know what you just said, I heard in Southern California, San Diego County, one of the tribes down there, during the first, I want to say 4 months of the outbreak of the pandemic, he said, we're talking about this COVID-19, but we're losing people. I think at that time, that tribe had lost 0 deaths to COVID-19, but I think he said like 7 people had died during that same time period. Pretty significant. And I agree that goodness, if there was a concerted effort to concentrate on this serious problem that's all over America, especially among Native Americans, boy, we could be maybe we get some steps ahead on this.
Exactly. And we have to try. And a lot of us tribes are already doing it. And that was one thing that we learned at the summit is how can us tribes get better organized and work together and provide mutual aid with each other so that we're doing it as well. And I think we have to start somewhere, and to get everyone at the table. That's what was so beautiful about the state tribal opioid summit that we just fentanyl summit that we just hosted was we had so many tribal leaders there, and the governor that was there and his cabinet members, the secretaries and directors were all sitting at the table, not just providing testimony, but talking about solutions, gaps in policies and laws and funding capacity and resources that are needed for us to be able to take care of ourselves. And I also want to make another point that you just brought up, that during the pandemic, we showed, for us here in this area, we showed that we can do it, that we know how to take care of ourselves, that we have the capacity to do so. And once we were given the resources to do it, we were really able to stop a lot of deaths and serious illnesses to COVID-19. And not only that, we also took care of our surrounding communities here too, the cities and the county and other areas around us. That's what we learned, is how one thing happens here impacts all of us across the nation. So we're very hopeful that we'll make some progress. We just have to keep momentum and keep making it a priority and keep working together.
Thank you to our platinum sponsor, the American Dental Association, for making this live stream possible.
And Chairman, when you talk about solutions, the first thing that I think of, like understanding this issue and explaining it, and also like I think that there's a lot of stigma against drug use for all populations, but particularly for populations of color and particularly for Native populations. There's a lot of stereotypes associated with substance disorders and dependencies that all really at the root of it date back to colonization. And I wonder if like addressing some of those underlying issues and explaining some of those underlying issues is part of the solution as well.
Absolutely. So we all know of historical trauma. We all know of a federal policy that wanted to kill us, to kill the Indian and save the man. And we still see impacts of that historical trauma today. I mean, can you imagine if you're a parent, to have your child be taken away from you and brought to a boarding school and under conditions where they were being killed at sometimes, or being completely stopped of their identity and who we are as a people. And so we still deal with that today. And I'm really glad you brought it up, because from the summit we talked about not just the mentioning of historical trauma, but historical healing. And that's what we're doing as a people. We're still healing from what's happened to us. And we talked about empathy because of the stigmas that happen out there. It's so easy to have opinions of each other or to have past judgment on someone. And that's like, it's just the lowest form of human knowledge. But to have empathy, to take yourself out of your own shoes and put yourself into another and surrender your ego, really can help us build some change. These are people that are struggling, and that was mentioned too, that we can have all the resources in the world to help somebody who's struggling with addiction. We can't force them to access it. We can't force them to be there. But what we can do is we can heal. What we can do is we can grieve. And that's what one of my elders talked to me about, is what do we do when somebody goes into hospice, when someone is dying of cancer and there's nothing left we can do? the family surrounds them. They go be with them, they hold their hand. And not only that, the community stands behind the family. The community will take care of them, the mother who's crying, and give her a hug. And we start grieving, we start to heal. And that's what we want to do. That's the mindset that we have in addressing this drug epidemic. Regardless of what people's stigma are of those struggling with addiction, well, we want to take care of them. We want to take care of the family who's hurting. No mother wants their child out living in a homeless encampment and taking fentanyl every day just to not feel the withdrawals, and who's struggling with other, issues maybe in their lives. We want to, at the very minimum, be there for the family. And let's start grieving. Let's start healing now. The bottom line to fentanyl is death. And so if somebody's really struggling with addiction, then at the very minimum, we can be there for them as a people, as understanding, of having empathy. And then the great part about it that gives us hope, that gives us light, is that in comparison to hospice, if somebody's struggling with addiction to fentanyl, there's alternatives, and we can ask and provide and promote all of the resources that we have every day. And that's where these partnerships come into play. That's where we need funding for a secure detox facility, a regular detox facility. We need better organization for how we provide treatment and beds for our people who are ready right now to get well, and not have them wait 2 weeks for something, and by that time they're back into that world of drugs and addiction again. So we're even with that stigma out there, it's never going to stop us at Lummi for loving and caring for our people.
Speak to us, Chairman, and that's pretty powerful. That comparison to someone being in hospice. But speak to us about how cross-generational is this? Is this something that's just impacting youth, middle age, or even elders? Tell us about that on your reservation.
I don't want to get emotional, but when I first got involved with council and tribal leadership, I was brought to see our elder. Her name is Auntie Rosalie Scott. She's the director of our Lummi counseling services here at Lummi Nation. She's the one who started it all here of addressing substance abuse. And she's the one who pounds her fist on the table saying, we need a detox facility, that we're going to build a detox facility. And when we talked to her, when I sat with her, she was emotional and really, really wanting the best for our people, and really scared and fearful of the impacts of fentanyl, because when she started the program, it was mainly for alcohol and some other substance abuses, but there were a majority of adults, of people that are kind of middle-aged and that were using alcohol. So fast forward to 40 years, 50 years later, today we have teenagers coming in to get treatment for opioid use or other substance abuse that is really, it's really painful to think about. That they're getting younger and younger, the ones who are being impacted by this world, these negative aspects of the world. And it's just so sad that this is a time that we're in, this world, that we have to educate our children of fentanyl, that we have to educate them about drugs and addiction, and that they're just supposed to be kids, and that's the scariest part. And to have a drug that not only just the smallest amount can kill you, but also that it looks like candy, that it's meant to target the younger generation so that they can get hooked. And it's so highly addictive and deadly. We're really fearful of that. But my Auntie Rosalie, she's that's the toughest part to this. You know, she's our auntie, she's our elder, and to see how this has progressed over 50 years, and now we're trying to take care of our children and protect our children. It's just it's unreal.
Well, go ahead, and Jen, I'm going to let you have the last question, but this is such
Okay.
yeah. Go ahead, Jenna. Yeah.
Sorry, I think I'm on a bit of a lag. You mentioned, Chairman, a bit about treatment facilities a few times throughout this conversation, and I'm wondering what those treatment facilities look like. Like, for example, we know through our own reporting that other tribal nations have opened methadone clinics or have started initiatives to distribute Narcan and life-saving opioid blockers, I think is what they're called.
Yeah.
Has your nation worked towards a solution of this nature, or that requires more funding, or where are you at when it comes to treatment centers that look like that?
Yeah, great. Another really great question. Yes, we do all of that. We do medication assisted treatment, counseling services, and one important thing that I want everyone to know is at the very center is our culture, is our way of life. It is, yes, we have these medical services, but it is a place where we can remain connected to who we are as a people, to our identity, the things that, you know, we were talking about earlier, the things that we have lost, you know, throughout our history that we're trying to gain back. That's the most important part about all of this, is that we know how to take care of ourselves. We know what to do. We've been doing it for thousands of years, since time immemorial, and we still carry that teaching today. You know, that's what got us through genocide. That's what got us through the boarding schools and the Indian Removal Act, and so many more that wanted to get rid of us. You know, we're still resilient because of that. So that's what treatment looks like for us, is yes, the medication assisted treatment, methadone, Suboxone clinic, and as well as we just opened a New Life Stabilization Center, which is an expansion of care. It's all of the services we're already providing, but we're doing it 24/7 now, whereas we'd be shut down after a certain time during the day and on the weekend. Now we're open 24/7, and we have beds available for people that need immediate help. And that only touches the overall impacts that fentanyl has had. This is just like we cannot wait. We have to do something. And so our vision here at Lummi Nation is to build a full-on detox facility and a new Lummi Counseling Services facility, which includes the medication-assisted treatment and the stabilization center that we just opened. We're really hopeful. We have the model, we have our culture, we have our values, we have our teachings. It's really just trying to get well, three things: better laws that support us, better funding resources that will help us build our capacity, and third, and probably the most important, is understanding from the state government and the federal government that we know what to do. And we proved it during the global pandemic. We have proved it over the years of the threats and fighting against us, and we're still here. We know what to do. And if we can get the understanding of who we are as Lummi people, understanding of our shared history of the Point Elliott Treaty of 1855, and the secured rights that were promised to us, and we can really get some work done. And if the state from this summit walked away at least knowing more about us, of who we are, and that we're not bad people trying to do good, that we're some of us were sick and just trying to be well. And we really hope that we can make some change. And in addition to that, at the summit, we had a culture night, and we brought the state agencies to our community building, the Waclium, and shared with them our culture and our way of life, our songs, our dance, our language, and the room was full of our drum groups and all of our children that were dancing and singing. And the chairman of Nisqually, his name is Willie Frank, he said it best that the children there, they really woke us up. They woke us up that we need to be thinking about this, that we need to be reminded that we're doing this for them. And so when we talk about treatment and some of our needs, it's that. It is it's ensuring that we never forget who we are and where we come from.
Well, Chairman, you have a very positive approach to a very bad problem, and we at Native News Online are committed to keeping the story out there. It's so big across Indian country and with non-natives. So I would like to have you come back at some point, and there'll be, at least I'm going to try to come out to the national summit at Hillaire. I'll try to come visit you at that point. But keep up the good work, and to our viewers, thank you for tuning in to another episode of Native Bidaské. Today's subject matter, the opioid use up in the Lummi Nation in Washington State, is something that is so horrific to the tribal leaders. They're trying to take action with the summit and meeting with state leaders. So join us next week for another edition of Native Bidaské, and have a safe week.
Good.
Thank you to our platinum sponsor, the American Dental Association. If you appreciate what we do here at Native News Online, we invite you to donate to support our continued work covering Indian country. You can scan this code with your smartphone or go to the link located below this video to donate today. We greatly appreciate your support. Please be sure to subscribe to our YouTube channel and follow us on Twitter, Facebook, and Instagram. And be sure to scan this code or go to the link below to subscribe to our newsletter. Thank you for joining us today, and please be sure to join us again next week for another episode of Native Bidaské. Chi miigwech.